I was inspired by ABC technology due to the fact that it has ease of use, efficiency, and it can be used as a hemostatic agent in my orthopedic oncology practice. I use argon beam coagulation in the treatment of tumors that are usually benign aggressive tumors. For example, giant cell tumor of bone, chondroblastoma, to name a few. And so when you're trying to remove these tumors, they have a high risk of recurrence. And so if you're just going to curette them out, the risk of recurrence sometimes is 30 to 50%. So the data shows that using neoadjuvant treatment in order to decrease the risk of local recurrence is important. So I choose argon beam coagulation for that. I use the 6-inch bend-a-beam to be able to get me into all these nooks and crannies within a deep cavity in order to also get the superficial and proximal cavities that I can't see specifically with my eyes. So efficiency is extremely important. So using the ABC technology gives me the ability to remove a tumor and then limit the amount of time that the patient is under anesthesia and limit the amount of time the patient is under a tourniquet. Once again, decreasing the risk of leaving any tumor behind. Strong eschar integrity is important when using the ABC coagulation because it allows me to understand that the area that I just coagulated, let's say possibly a soft tissue tumor, is then stable. And I understand that that area is likely not going to bleed or spread anymore, and I can trust its stability. For me, if I wasn't going to use it, or I was going to use a different modality, then I'd have to treat that patient post-operatively differently. I'd have to monitor them more closely to see if local recurrence was going to happen quickly, maybe protect their weight bearing slightly afterwards for a period of time, and watch them closely for any sort of bone fractures, etc. The use of argon beam coagulation and its ability to decrease fluid in the cavity is very important because during this type of procedure, I want to limit any spread of these possible tumors. I would say that using the ABC technology versus another technology such as Aquamantis can be beneficial. When you're adding saline, you're creating a wet environment, and that fluid will run where gravity takes it and have the ability to, seed that region locally. So having that dry ability to create hemostasis and not create the possibility of spreading locally is important for a tumor surgeon. I would say the cost of integrating ABC technology into your practice is not going to create much of a problem overall when you compare it to the possibility of having to reoperate on a patient and the cost to the patient and the hospital system. So the ABC allows me to decrease the risk of their local recurrence, allows me to feel more confident that I'm not going to have to bring them back to the operating room, and allows me to trust the surgery that I performed.